What is important for a physician is a product should be evidence-based medicine. I have spoken with a lot of their researchers. I have gone to the country where it started. I have seen the studies done by universities. And of course, I have read their articles. In the many years that MIME have been on the market, I have seen great results with other doctors as well. But of course, as the saying goes, the proof of the pudding is in the eating. So first, I tried it to other people, including my patients. Now, I see patients coming back to me and saying they have seen great results when I've given them MIME. I believe, together with their other treatments, when we include MIME, they are in better health. There are truly many other forms of mushroom products and other supplements out there. However, MIME is different because of the extensive research it has undergone. What is important for us doctors is that there are peer reviews, there are studies on the particular product and not only on the ingredient itself. What is important for us also is that it be compared with the other medications that we are regularly giving. Right now, MIME is one of those on top of the list that helps improve the immune system, that helps us recover faster and gives us more energy. Many people believe that just taking plants in their natural form is at par with those that has undergone research. But the truth is, MIME have been studied for a very long time and by noted scientists, and they were able to extract the active ingredient that helps people improve their immune system. It does so by increasing our own natural killer cells. And just by boiling certain plants, like mushroom, or taking it as part of our meal is not equivalent to taking MIME, that is a very good product for doctors to prescribe. First and foremost, MIME is a nutritious product. But because it is an extract that works in a body by increasing our own immune system, we are helped greatly. Because first, it increases our natural killer cells. Those are made up of the T cells, the B cells, the macrophages, the white blood cells that are important for a person to battle against the many infections as well as autoimmune diseases surrounding our body. But right now, what plagues our society is the development of tumor cells, maybe because of our lifestyle. And MIME helps our body produce the necessary cells to fight off many of these diseases. My patients, of course, receive my prescription after history taking, after physical examination, and evaluation of their laboratory studies. I prescribe it generally on a healthy individual at about 3 to 4 capsules per day. But for my patients who are quite ill, I prescribe a double dose of it, once in the morning and once in the evening. And sometimes I even give it in the middle of the day. I believe that by constantly supplying the body with this natural ingredient, the body is able to cope up better with their illnesses. So right now, I give a lot of MIME to the patients who come out of my clinic. In fact, maybe 7 out of 10 of these patients who are chronically ill will receive a prescription for MIME. Although I have been speaking about MIME greatly on how it helps cancer patients, as well as those undergoing a lot of therapy, I have been prescribing MIME for other health conditions as well. This would include people with recurring infections. This would include people with allergies. And of course, because I have seen how greatly their health condition has improved. Right now, I have been prescribing it as well to patients who are not sick but would just want to prevent illnesses in their body. We have to accept the fact that right now there are many people who are carriers of many diseases. There are many different viruses that are developing in our system. Plus, we have a lot of people with positive family history of major illnesses that they would like to prevent in their body. So I have opened another clinic that is solely for preventive and wellness medicine. These are the people who request from me a way to prevent illnesses, and one of that is through the use of MIME. There are not many people who develop rashes and other symptoms when they take MIME or other immunosuppressing as well as immunotherapy medication. I believe that reactions to MIME are temporary. They may last for maybe 5 or 7 days only, and they are quite minor. So for people who are quite afraid of these reactions, I just reassure them that they can take MIME at a half of the dosage I have prescribed. After a week or 2 weeks that their rashes have resolved, I ask them to go back to my usual dosage. These healing reactions is just a body's way of reacting to something that is very powerful, that is all natural, and may be compared to cleaning the house. We know that by cleaning our house, we see a lot of dust floating in the air, and that is like our body. When our body tries to recover, it cleanses our blood, our other immune system, as well as it improves now our quality of health. Not so many people actually have healing reactions. There was once a doctor from Germany whose name is Dr. Herring who explained it simply. For the many years that our body is exposed to all the chemicals surrounding us, to all the wrong kind of food that we eat, of course, our body will react strongly against a food that is so nutritious and powerful. But this is not a bad reaction. It is our body's own way of saying we have to get rid of all these toxins so that the good product like MIME can take its effect. My belief is that this is a temporary reaction, and all they need to do is be reassured that they can reduce the dosage for about a week or 2 weeks, but may resume it later on once the rashes have healed. By taking MIME continuously without stopping it, their body is benefited by cleansing and by immune system health. I still work with fellow doctors and oncologists who uses surgery, radiotherapy, and chemotherapy in the battle against cancer. Many of the doctors realize now that we have not won the battle against cancer. Maybe because we have not accepted the fact that our own body is its own defense mechanism, that we are the last frontier in fighting the cancer only if we raise our immune system. Many of the medicines that we prescribe do not enhance our own immune system, and MIME is at the forefront of that. It helps us produce our white blood cells necessary to fight off these cancer cells. So I believe a person or a doctor who is really intent on fighting cancer and promoting quality of life should not only include the surgery, the chemotherapy, and radiotherapy. They should also consider including MIME. I do not believe that any product that raises the immune system, like MIME, will interfere with the treatments. Of course, many doctors would rather say, do not take any of this nutritious product, anything that will improve your immune system while undergoing chemotherapy and radiotherapy, as they believe it will interfere with their medication. But on the contrary, a body is constantly repairing itself. And we only get that from our food that it should be nutritious. MIME should be considered a nutritious product. A product that when taken goes inside our intestine. And in the intestine, it stimulates the Peyer's patches. Those are important parts of our body which produces the T and the B cells. And we have to remember that our body, while being devastated by the cancer cells, may also be devastated by the multiple drugs that they are taking. With MIME, regeneration and repair of these cells can happen. Well, since I have been doing this for about 5 years, and many of my patients have been receiving it, I have seen a lot of great results. In fact, many of my patients who have been given less than 2 years to live have been coming back to my clinic for more than these 2 years. I have seen them for the last 5 years, and remember, with my 20 years of experience, I know when a patient has an improvement in their quality of life. I see people who come back to me with better strength, with more optimism in their life, because they are eating well, they are sleeping well, and they can be rested well. I have seen the studies of other scientists when they were doing a lot of research with MIME. I have studied their own researches, and I have collaborated with local colleagues who are now doing studies with MIME and the production of dendritic cells, particularly for breast cancer. I have seen in my own patients wonderful results, and it is a miracle that I would recommend to fellow doctors as well. I would like to propose that QOL, or quality of life, should be another branch of medicine as we practice our craft and tackle a lot of these chronic and degenerative diseases. People must not be considered as organs only. People must be treated as a whole. The treatment should not be focused on symptom reduction alone. People must have regeneration of their cells. People must go back to their activities of daily living. Not only should their lives be lengthened, but with misery, but their lives should be improved as well. Quality of life is very important for patients. It should be important for doctors as well. And we can only get it if we prescribe to them a product that will help improve their immune system. MIME is one of those products that increases our capability to better quality of life. MIME was first studied for its immune modulating properties. It may be considered an adaptogen, whereby it helps the person adapt to its normal living condition. But right now, I have seen a lot of research being done on it for other illnesses as well. I have seen a pediatrician doing research on MIME for those who suffer from seizure disorder. And the results have been very promising, perhaps because it helps revitalize the nerve cells and the brain again. I have seen studies on how MIME helps in many digestive and elimination system diseases. This would include Crohn's diseases and ulcerative colitis. Patients have reported a reduction in the symptoms of abdominal pain, reduced bouts of diarrhea, and even bleeding. Other studies include help for the nervous system as well as for the skeletal system. I think MIME has a long way to go for helping people with other forms of diseases. It is a dynamic product for a dynamic science. Stage 4 cancer is not necessarily a death warrant. In my own clinical practice, I have seen a lot of success stories. And as well as I know, with my colleagues, have seen a lot of good results, even with a terminal illness like stage 4 cancer. I have seen metastatic cancer that has spread to the bones. I have seen pancreatic cancer that has given a patient a bloated stomach as well as jaundice. But with MIME, I have seen great results by improving their quality of life. And with the short lifespan that has been given them, I have seen it doubled or tripled. The patients report back to me a patient that has a better condition. The relatives are happier as well because they know that with the product called MIME, they are getting the best of both worlds from the scientific point of view of the Western doctors, as well as those who use nutrition and diet as part of therapy. I believe stage 4 cancer patients are the best who need MIME. Doctors like to stage cancer based on the tumor size, based on the lymph node that is present in the body, and based on the spread in the other organs. But a doctor must not only look at the TNM or the way we classify tumors. What is important is for a doctor to evaluate the patient as the patient is in front of them holistically. The doctor must take note what the patient is feeling, the distress that the patient is undergoing. Therefore, my prescription for the dosage of MIME depends on how the patient is recovering or at presently is ill. I prescribe from 3 capsules daily to 3 capsules twice daily and as high as 20 capsules per day. I believe that the more they take MIME, the better that their immune system will be able to cope with terminal stage cancer. New researches are being done about autoimmune diseases, and we realize that a lot of the problems that we have right now in this modern lifestyle that we have is due to autoimmune diseases. Infections from microorganisms can affect and wreak havoc inside our body, from viruses to bacteria to fungi. These can result in allergic reaction and many other autoimmune diseases like SLE and rheumatoid arthritis. You know, our body is capable of repairing damage to it. If you notice, if we have a wound, and as long as we keep it clean, the skin will heal by itself. But when our body is weak, when we do not have enough nutrition, then the wound healing could not take effect. This is the same way which happens inside a body of a person who suffers from autoimmune diseases. The body would like to heal itself, but the reactions are sometimes slow or severe, whereby its own cells attack our own individual organs. That is why, for patients who suffer from autoimmune diseases, the treatment that is usually being given by doctors like steroids are not sufficient. What is important is that we give something that will enhance this immune system so that the body will recognize itself. By doing so, therefore, regeneration and repair can happen. I have prescribed MIME for cases with SLE, and they have seen a reduction in the rashes on their face. their laboratory results are much better than when they were taking steroids alone. I believe the future of autoimmune diseases is through products like MIME. Because of the great results I have seen from those who are already terminally ill and those who suffer from chronic diseases, I am assured that this would be good also for people who just want to prevent illnesses in them. But a lot of people get sick because of their habits and lifestyle. People eat wrongly. People do not sleep enough. People do not exercise. And people take on so many tasks. And this is a lot of toll for a body that is already fragile. For me, people that are healthy and would like to prevent getting sick, people who are so stressed should be taking MIME on a regular basis. Gout is a condition where uric acid accumulates in the joints and causes a lot of pain for those who suffer from it. But if you notice, very few young people suffer from gout. And this is mainly because their kidneys are functioning properly and they are able to excrete the uric acid from the diet that they take. Because MIME comes from mushroom, people believe that it may produce gout in them, and therefore they are afraid to take it. But in reality, MIME is an extract of the mycelium. Therefore, very rarely will it cause gout or complicate other causes of pain. In fact, I believe that with the use of MIME, the health of the kidneys are more enhanced. And like a younger person, the kidney that is healthy will be able to excrete uric acid more properly. Diabetics are always afraid of those that are sweet, not considering the fact that glucose comes in many other sources, like the carbohydrates that they eat from too much rice or too much starch or too much bread. The sweetness that they experience from the capsule of MIME is not enough to raise their blood sugar, and therefore I don't think it should be of concern for the diabetics. The benefit that they will get from taking MIME